Good morning viewers, I am Dr. Vimala Manne, Medical Director of Dr. Vimala Skin, Hair and Laser Centers at Gachibowli and at Mehdipatnam. So today let's talk about baldness. Baldness is increasing a lot. It is a major concern because hair is something which people love. Social acceptability is better. It gives them a lot of confidence if they have good hair and they look much more presentable, whether it is in their fields of media, whether it is in the fields of work, wherever it is, the presentability has become very important nowadays. But very young age adults also are complaining of baldness nowadays. Previously, baldness was at the age of 50 or 50 plus group. But of late, even 25 plus age group people are complaining about baldness. So what is this baldness? It is actually thinning of hair. It happens for men at both the sides, which is called temporal areas, and slowly it is lost in the center of the scalp, which is called as vertex. So initially the hair is thinned out and later hair falls, revealing the scalp. So why does this occur? Usually it is a genetic predisposition. So the genes are acquired either through maternal side or paternal side. So whenever a patient complains of hair loss, we usually ask, is there a family history of baldness, maternal side or paternal side? And then we go ahead with the treatment. So family history is very important. So when there is a family history of baldness for your dad, maternal side, mother's brothers, mother's father, that is grandfather, maternal side or paternal side, you should come to a dermatologist and trichologist at the initial stages only and take valuable advice. So there are various treatments available for postponing and preventing baldness, because once the baldness happens, whatever restoration or regrowth of hair which we can get is very limited. So it is better to actually take care and take the precautions prior to hair loss. So what happens in this baldness? In the initial stages, when thinning is very evident and the family history is positive, we actually put them on preparations which contain minoxidil, various peptides, but the best treatment is something called as PRP, platelet rich plasma treatment, microneedling, and these are the techniques which stimulate hair growth. In microneedling, ideally the derma roller is an older technique. The newer technique is with derma pen, wherein we create micro injury to the scalp, and this causes stimulation of hair growth by increasing lot of growth factors and vascularity to the area where we do derma pen or microneedling. So we are actually fooling the body that there is some kind of trauma which is happening onto the scalp, so that the body diverts all the vitamins, blood, nutrients to the scalp, and this stimulates hair growth. The major one which we do is called platelet rich plasma treatment. Here we draw the patient's own blood, separate the platelet derived growth factors, and then infuse into the scalp. This is a very good technique which helps in growth of the hair, and it gives a very rejuvenated look to the hair. The hair feels more silky and healthy. So there is increase in volume and thickness of the hair with a combination of microneedling and with the combination of platelet rich plasma treatment. Is there any contraindications? Usually there are not contraindications. Only for people who have blood disorders there's contraindications, but others we can go ahead with platelet rich plasma treatment. And who are very anemic, we do not do platelet rich plasma treatment. And smokers, this treatment is less effective, so smoking is not good for your hair as well. Anyway, we know that is not good for your health. So these are the things which we have to take care of. The results are great. We do a couple of sessions. Within 3 months you see very good results, and PRP we usually do once in a month. So after 3 months you will see some good improvement, and once the treatment is done, we along with this treatment we give the medications as well. We do a complete analysis of hair loss, wherein we do some tests and trichoscan. and if there's vitamin B12 deficiency, vitamin D deficiency, serum ferritin is low, we add all these adjuncts, vitamins, because you cannot afford to have a nutritional hair loss or a stress induced hair loss when you are already having baldness or when baldness in progression. So holistic remedy is given. So apart from prescribed topical solutions of minoxidil, oral vitamin supplements, microneedling and PRP, we also give a very good diet sheet suggesting what are the good food and diet and lifestyle changes which you have to take care so that your hair remains healthy. I hope this has given you some view about baldness and how we can treat baldness. Thank you viewers, and thank you for your patient listening.